How do medical research institutions support female bladder health after spinal cord injury? How do medical research institutions support female bladder health after spinal cord injury? This question touches on several important areas of research and care. Medical research institutions play a vital role in enhancing bladder health for women after spinal cord injuries. They do this by advancing our understanding of bladder function, developing adaptable management strategies, and exploring innovative therapies. One key area of focus is understanding how the spinal cord controls bladder function. Researchers have made significant strides in identifying specific spinal cord areas that correlate with bladder pressure during filling and emptying. Advanced imaging techniques, like functional ultrasound, help in this understanding. This knowledge is crucial because urinary incontinence and neurogenic bladder dysfunction are common after spinal cord injury. These conditions can severely impact mental health and daily living. By understanding the neural mechanisms behind bladder control, researchers can develop targeted therapies to restore or compensate for lost function. Another important aspect is the development of long-term bladder management strategies. Studies show that bladder management needs to be adaptable over time. Initial management systems often address urinary retention during the spinal shock phase. However, as motor function changes and complications arise, these strategies must evolve. Research highlights the importance of individualized care plans that consider a patient's physical function, preferences, and overall quality of life. This includes decisions about catheterization methods, medications, and other interventions tailored to the patient's changing condition. Additionally, research institutions investigate the impact of different catheterization methods on regaining voluntary bladder control. Studies compare intermittent versus indwelling catheterization to define best practices. This helps minimize complications like infections and improves functional outcomes. Understanding these associations allows clinicians to recommend the safest and most effective bladder management approaches for female patients. Institutions are also exploring novel therapeutic approaches. For example, they are investigating bioresorbable polymer scaffolds that can be implanted in spinal cord injury sites. These may promote nerve regeneration and improve bladder function. Research into cellular and molecular mechanisms, including the role of small extracellular vesicles, may also open new treatment avenues. Finally, the evolving nature of bladder dysfunction after spinal cord injury requires ongoing research. Medical research institutions emphasize the need for continuous monitoring and adjustment of treatments. This ensures that bladder health outcomes are optimized for women, recognizing that progressive motor decline can influence bladder function. In summary, medical research institutions support female bladder health after spinal cord injury by enhancing scientific understanding of spinal-bladder interactions, developing personalized management strategies, evaluating catheterization methods, and exploring innovative therapies. These efforts aim to improve bladder control, reduce complications, and enhance the quality of life for women living with spinal cord injuries. Always consult healthcare professionals for personalized advice and treatment options.